There needs to be a change. I mean, that's obvious. Things that are the way they are now is not working.
Like, some people can't even take care of themselves. We got people out here that's homeless.
We lose a lot of people in this world that don't have help. It's every day. It's not just one day. It's every day.
Sometimes people can hide their problems and like take it out on other people or things, like do drugs and stuff.
Our kids are struggling, and it's important for them to get the help that they need or that they don't even know that they need.
There are youth and there are people that are getting a start in life and they're automatically starting on the wrong path because there are things that aren't accessible to them.
I'm going to ask you what Villa does for you.
Okay, go ahead.
We do a lot of work and we get smarter. So we do math and homework. Calm down. And when we get in trouble, we do belly breaths and breathe in and breathe out. And it helps us not get into fights like each day. That's it.
That's it. His temper has definitely changed. He's had a big change in his temper. Before he started services here, he was awful. And a lot of people, if they first met him and did not know about him, you know, their first reaction is, oh, he's a bad kid. But since I started and actually learned more about his disability, like through services and PRP and things like that, now I know more what to do with him.
I know we have a lot of mental health centers around Maryland, but it seems like we need more resources for more workers in those agencies. If you have 50 agencies, but only about 2 workers in each of them, it's kind of hard to deliver the services you need to.
We need more resources. We need more. I find it every day, like I'm working and I work with great people, and we do awesome stuff for the kids. And then there's this in-between like of outpatient and inpatient. But the space in between, that's where we have some resources, but they're spread thin.
If we had early education and if we had resources given to people at a younger age, then they would know where to start. They would know what the next step is. But until we have access to provide this kind of education for the youth, we're going to be in this cycle, this constant cycle of in and out of rehabs, in and out of institutions, struggling with homelessness, and all of this is going to continue unless we do something different.
One of the major things that makes a difference in youth lives is being able to have a place where they feel seen and heard.
I think one of the most important beneficial factors to the youth population would be making sure that everyone's heard.
Sometimes I can say what I've seen in my line of work and also my own recovery, that sometimes those who are helping or offering services try to force their own agenda or own opinion on the person that they're working with.
I've been told when I was in the hospital that I wouldn't return to a normal baseline. I was so sick that I would never return to a normal baseline. I've been told that I don't have any value. I've been told I'd never be able to go off meds. I'm now in remission, so I'm med-free and I take really good care of myself.
I am of the belief that people are the experts in their own lives, and so we can all use help from one another and assistance from one another, but your lived experience is what you know best.
Older people, we come from this evolved place of education, some cases experience, and so we forget that, you know, some of the issues and barriers that we had. And so what we want to do is we want to, you know, open up and allow, you know, give our young people voice and choice.
I would love if in Maryland we would invite youth
to more of the decision making, especially when it comes to policy and advocacy. I think a lot of times they create the programs and then they bring in the youth and they're like, oh, let's hear your opinions on things. But I think there's a lot of value if you bring youth in the beginning in the infrastructure of these programs, because they know what they want, they know what they need.
The older generation tends to talk about mental health or have a stigma for it because it seems as invisible or that we don't need it, but it affects every aspect of your life.
Without a stable mind, you can't have a stable body.
I struggled with mental health starting in like 7th or 8th grade. The lady I talked to, she helped me out a lot. I felt like I really got something out of it, and I never would have thought I would because I never really believed in it. I was like, I don't want to do no therapy. Like, I'm fine. That's how I thought of it until I actually talked to someone and she understood where I was coming from.
I talk about basketball with my therapist and how to control my anger and what to do when I'm angry.
Has it helped?
Yeah, it helped.
Do you think that it's important to have youth involved with mental health?
Yes, because there's a lot of reasons why some of the youth do what they do out here, because they don't have no one to turn to.
You know, I'm in college. We have like health centers and you have a counseling center, but like to the average person who isn't in school, you would have to like pay a lot of money just to see and talk to somebody.
If you had $1 million, what would you do to help kids like yourself?
Some people I know, they have trouble getting to places and like from places. So like I would help them like try to get maybe like a vehicle maybe, or another one like that. So some like just like some people can't get to and from places, maybe if they like have school, maybe like they can have therapists at school.
I know schools, we have, counselors and things. It's not really like, oh, let's everybody go talk to the counselor. Like, there's not really like mental exams for children or anything that I think there should be.
What changes would you like to see happen here?
Maybe not so much like more therapists going in and out, because I've had a lot of therapists and I can tell like it's hard for some people to open up to like new people.
If you could change anything about Villa, what would you change?
More rooms and more chairs.
Why more rooms?
So it can be more people.
Why do you think students need to come here?
Because some more people got ADHD.
If you had $1 million, what would you do to help kids like you?
Get some new students.
Yeah, why do you want new students?
Because there's only a little bit of people there.
Yeah, and why do you think this place needs more?
In a way, everybody can have their own therapist.
Why do you think that's important?
The way everybody don't be fighting and cussing and destroying stuff.
All right, you got 3 wishes.
Fidgets. Safe places. And a stress ball.
I have $1 million. It wouldn't be enough because like it's a lot of kids like me, and I would like try to help them with their biggest problem and like try to get kids into better schools and help them with expressing their feelings. So when they grow up, they don't like think that nobody cares.
If I could speak to the lawmakers about what changes I would like to see in mental health, I would ask for more of a way for our voices to be heard.
At the end of the day, people who are making the decisions are not the ones actually going through the different trials and tribulations and the trauma that is involved. And I think we need to be mindful that lived experience is valuable and it should be at the forefront, and when somebody speaks up and they tell you what they want, which is such a brave thing to do, to stand in your own, to stand in your autonomy and be like, no, this is how I want to be treated, this is where I want to go, this is the medicine I want to take, this is how I feel in my body. It takes a lot to be able to do that.
I don't believe that we should tear the system down that currently exists. I'm just asking to carve out some space for something new and innovative.
I don't want to be a cliche, but again, they say the youth is the future. If you don't make sure that the foundation is solid, the whole building can collapse. So if you don't make that effort to make sure that the youth have solid mental health or solid overall well-being, where's the future going to be? Where is their individual, our whole future going to be?
Anything else you want to say?
Yes. And more on your kids. We can do this. Hold on.